Ladies and gentlemen, good afternoon. My name is Michaela Zelinkova and I'm a marketing manager at BTL Prague headquarters. It's my true privilege to welcome you here on behalf of BTL at our today's symposium called Redefining Health Span in Aesthetic Approach Integrating Mind, Facial, Muscle and Skin Innovation. First of all, I would like you to introduce our extensive speakers today. First, we have Dr. Amarpong Vachiramon. Dr. Amarpong Vachiramon is the clinical director of Vertex Plastic Surgery, Skin and Dental Clinic in Bangkok, Thailand. Internationally trained and board certified in oral and maxillofacial surgery and orthodontics, he is recognized for his multidisciplinary expertise spanning facial aesthetics, implantology, dental sleep medicine, and lifestyle medicine. With extensive academic and clinical experience, Dr. Amarpong is a respected educator and a speaker in the fields of aesthetic and regenerative medicine. Dr. Amarpong, the stage is yours.
Hello. Hi. Good afternoon, everyone. It is my pleasure to be here to talk about the routine technique, or we're going to talk about how we stimulate the brain today. Okay. My topic today, I'm going to talk about rewinding the mind, how ExoMind enhance the mental wellness and longevity. Okay. Someone actually could help me on this. Okay, just some disclosure. Talking about some numbers, when you look at the WHO numbers, okay, thank you. Okay, when we look at some numbers, it's surprisingly actually, when you look at the WHO, show the number 1.1 billion. 1.1 billion people live in a mental disorder, which is a huge number. It means that nearly 1 in 7 people globally have some of the mental disorder issue. And you look at 280 million people live with depressions, and 720,000 people die from committed suicides. That's a huge number. It means every 43 seconds, one of the people actually committed suicide. That's a huge number. And 2/3 of the people who have the depressions never get any kind of formal care. This number shows you this is a global emergency situation that we actually need to be addressed. When you look at today, I'm going to talk about one small particular area of the brain that needs to emphasize, particularly on the left side of the brain, the DLPFC, the dorsolateral prefrontal cortex, particularly on the left side, that controlling the emotional regulations, decision making, and self-preparation. And this area is commonly hypoactive, like, with a normal routine life, hectic life, actually make this part of the brain hypoactive. And how can we manage with this? This will diminish the function, the control, the mind control of daily routine, daily life. How can we wake this area, wake it back up? Can we do that? I would say yes. Nowadays, when we're looking at the technology that minimally non-invasive technology that can be used to wake this area up. The RTMS, the repetitive transcranial magnetic stimulation, is a non-invasive technique that actually can apply the magnetic field to the head and induce the electrical currents in the brain to activate the neuron to increase the neural circuit, modulate the brain function. This is really good profile actually approved by the National Institute of Mental Health. How this thing actually works? When you look inside the DLPFC areas by the action. When you look at this area, you look at the area when the brain cell can connect to each other. These areas is stimulated by the magnetic signal, result in rebuild the lost connections and strengthen the weaken the existing connections and increase the neurotransmitters released in the synapses too. This is actually the pathway called like neuroplasticity, actually increasing the brain adaptability to the natural ability of adaptability. When you look at these pictures, this is a conceptual picture that shows that before stimulation, the neuron actually connected to each other very minimal, and increasing after stimulation can increase the connection between each other, and after stimulation you can see the big connection improve. Not only the connection that actually improve, the neurotransmitter release in the synapses increasing significantly also. These two mechanics actually will improve the connection between the brain cell. How this ExoMind work? The ExoMind is powered by the RTMS technology, but BTL actually created the new patented technology called the ExoTMS. ExoTMS is what is the ExoTMS? The ExoTMS actually enhance the magnetic field to be able to deliver the magnetics to the brain to induce the brain cell to improve the induction of the brain cell. And another thing is in terms of comfort, actually the way that this signal can be delivered to the brain, slowly ramp up the signal, the pulses still deliver. That's why the comfortability is actually more comfort also. And another one that the technology actually help with the switching frequency in the ExoMind machine actually reduce the is a mechanic that anti-adaptive pulse parameters that actually reduce adaptive function of the brain cell. Looking at the ExoMind can enhance the magnetic field, how it works. Improvement of the coil, wiring, the wiring of the coil actually can help to deliver the better magnetic field to the brain to induce the brain function. The air cooling system that innovation of the BTL actually help to be able to deliver the magnetics more efficient to the brain, while the benefit of this can help the patient we can deliver more pulses comparing to the traditional TMS, comparing to the traditional one. That's why we can reduce the number of the patients who come for the treatment. So don't have to come that often like the regular normal RTMS. This is another study actually showed that to get a patient adherence for the treatment adherence is important. If the patient come and the patient cannot get, it's painful for the treatment, we never get a patient back. That's very important. If you look at this ExoMind technology with the way that it's slowly ramping up and down, they're actually really more comfortable for the patients. You look at the pain, that actually much less comparing to traditional regular RTMS that in the market. This is a very important part. It not only we have enough good technology to be able to deliver this, but result is really important also. How can we look at the result of the ExoMind? You look at 90% of the improvement. 90% of the patient can experience a mental well-being improvement. 74% feel that less stress, and 77% feel more energized and a better mood. 71% experienced improved sleep onset, and 61% felt more confidence. Look at the mental well-being study. 90% of the patients found that therapy is more comfortable, and 90% of the patients improved in the mental well-being. When you look at the subject that who had really initially low mental well-being, 66% improved in moderate mental well-being, and 16% in average improved in a higher mental to the high mental well-being. When we look more closely to the moderate mental wellness group, 52% of the patients in this group improved to high mental well-being group. That huge significant improvement. Look at the factors. Look at the factor for longevities. Like when you look at the lifestyle medicine in the 6 pillars, you look at the longevity factor like diet, physical activities, risky substance, stress management, good mental health, the sleep factors like quality, restorative sleep. Positive families and social connection is one of the factors. Look at the highlighted one that we're going to use, the RTMS, that actually address that highlighted pillars. Firstly, the substance abuse like smoking, alcohol. The RTMS approved from the US FDA to show that we can help with the smoking cessations or other addicted situations, because RTMS stimulate the left DLPFC can improve the better control of the patient. They can control mind control, get a better control to avoid the abused substance. And another one is the RTMS can reduce craving for this situation too. In terms of stress management, the stress management is, it's already approved by the US FDA too. Excessive stress can induce the chronic inflammations, and with the RTMS can stimulate the left DLPFC to help with the patient, for the patient to adapt themselves to regulate the stress control themselves. Using the high frequency RTMS reduce the lower cortisol response to the stress too. The mental, in terms of the good mental health, various mental situations actually approved by the US FDA that show that for using the RTMS. Sleep is very important. We know that sleep is everything. When you look at the deep sleep, we can repair ourselves and our body for many situations. And look at the REM sleep that actually related to the memory consolidation. And another one that the RTMS significantly improve the deep sleep and the REM sleep too. This just want to recap on the highlighted one. Yeah. Safety is important. It's very important. If the device is actually not safe for the patients, that's not going to be approved, right? This is a non-invasive device, which is the safety profile is very good, very high. It means that it's very safe. Most of the side effects and complications is very minimal and temporary. And you see, like, some of the patients have some headaches, syncope, hearing problem, some issues like the mood swing, fluctuation, or seizure is the most important part, and luckily it's extremely rare to see the seizure. Even now, we use the RTMS to treat the seizure also. We look at, because I did my PhD in neurology, and we look at the RTMS actually how it responds to the brain cell. And we look at sometimes when we use the RTMS to treat the seizures also. Contraindication itself is, when you use a magnetic wave over the head, it's important over the skull when you actually direct address to be worried about the heat that come up with the metal. So when you look at the big piece of metal that actually in the way of the magnetic wave, that situation we should avoid the RTMS, using the RTMS. However, when you look at the small plate and screws that we do like facial fractures, the top and the jaw surgeries, mini plates that actually put on the face, look at this kind of small plate and screw is not going to be affected by the magnetic wave, which is the working distance is around 10 centimeters, which is very short. Relative contraindications is that pregnancy, just sometimes you use it, but you can avoid. Some of the patients who have history of the seizures, that another thing that we, for the beginners, I think we should avoid that kind of patients. But however, when you look at the number, right now the RTMS can be used to treat some of the seizures also. The history of the brain trauma is just relatively, it's not all the cases cannot be used, because sometimes we use it to help to stimulate the brain in the traumatic brain injuries too. In conclusions, RTMS is a non-invasive brain modulation machine, which is actually with safety profile is very high and very high potential benefit, particularly we use in our clinical use in our practice. And we need to, for individual patients, we need to balance between the risk and the benefit ratio in particular individual cases. Thank you very much.
Quite high. Hi, I am Professor Warapong Manaskiat. I am a dermatologist here. I am going to be your moderator. Thank you very much, Dr. Amon Pong. So we are going to switch from inside the head to outside the head. So we are going to change to another lifespan aesthetic, which is on the skin, on the face. And the next speaker, actually, she is a colleague of mine, Dr. Yanin Nokjet. She is from the Department of Dermatology, Faculty of Medicine, Sirirat Hospital. And Dr. Yanin is actually Romanian by birth, but Thai by blood. And you will notice her unique accent. And we've been doing research on the M-face together for 2-3 years. We published one study last year by using the original electrodes on the mid and lower face, and we found that it worked quite well and effective and produced quite a long-term outcome. And right now, we just finished another 2 studies. One study is using the submental applicator together with the psychomatic applicator. And another study is the use of the eye applicator. And today, Dr. Yanin Nokjet will share with you the result of a study that we've been doing at Sirirat Hospital. Please welcome Dr. Yanin Nokjet.
Okay, so thank you very much for your kind introduction, and thank you BTL for inviting me to be here today. So as Professor Warapong already mentioned, today we'll be talking about the clinical evidence of M-face in eye and submental reconstruction. First of all, as we are aging, the process starts with our skin with a lack of collagen that decreases every year from when you're over 30, and also the subcutaneous fat as well. Not only that, you could see that the ligaments and all the aponeurosis under the skin also causes laxity as well. However, there's one layer that hardly people mention about, which is the muscle. So if you look at more studies, you can see that the muscles also age as well, especially the elevator muscles. You know, when you age, you get older, they start to droop down. That's why your face looks droopy and all those laxity that you have. So that's why we come up with a new technology of M-Phase. The M-Phase incorporates the high-phase technology, which is a high-intensity electric field which emits simultaneously synchronized with RF. So it actually targets the motor neurons, and it also singles the muscle contraction. So instead of the loose tone that we have when we get older, it enhances the tone of the muscle fibers. Not only that, they also have the synchronized RF, which is a monopolar RF emitting simultaneously with the high-phase technology. So it creates a uniform heat to actually induce collagen synthesis and also the tightening of the skin as well. So there are now currently 4 applicators, as you can see. So the one we're talking about today is the eye and also the submental. But however, as Professor Warapong mentioned, we already had a study of the M-Phase technology with improving the facial laxity and quality of the skin in Asians. You can see that this study also improves significant skin quality and also actually elevates the brow as well. You could see within this picture, her brow height actually improved and the laxity of the eyelid also improved as well. So coming up to the newer applicator this year, we have the eye applicator, which exactly is targeting the orbicularis oculi. So this is a study we did with Professor Warapong at Sirat Hospital, Mahidol University. So with this one, you could actually target the periorbital aging. What happens when we age around the eye? Actually, the skin loosens up first, but not only the skin, the muscle also loosens, creates those bulging of the fat underneath, and then the fat protrudes outwards. So with the eye applicator that targets the orbicularis oculi, creating more tone in the muscle underneath, and also with the synchronized RF, creates neocollagenesis, it should help with the eye bag underneath and also the periorbital area as well. So what happens after we induce those collagen? You can see that the muscle tone is better, causing less puffy eyelids, and also helps with the lymphatic drainage as well. As for the skin, it also helps with reduction of the wrinkle due to the neocollagenesis and also the dark circles underneath the eyes. So we included 20 patients and follow-up for 6 months. The patients are quite old because, you know, eye bags happen we get older. So their mean age was about 50 years old and mostly were female with a Fitzpatrick skin type 4. You can see that the pain score was very, very low, even less than 1. So it's very tolerable and everyone is happy while doing it. So you could see that we also measured objective measurement as in volume of the under eye area to actually see how much it could improve. So this is one of our patients. You could see that the eye bag is better in terms of volume as well. So the volume actually significantly improved as soon as just 1 week after the second treatment, and then continued to improve at 6 months after doing 4th treatment. The wrinkles also improved significantly 1 month after completing 4 treatments and continued to improve until 6 months as well. As terms of patient improvement scale, all patients marked that they had at least moderate to very good improvement. Now let's see the clinical photos. So you could see that this is one of our patients. She is about 50 years old. You could see that the eye bags are really protruding at baseline, but at 3 months after completing 4 sessions, you could see that the eye bag actually decreased. And when you follow up at 6 months, it was still better than baseline, even without any further treatment. Our second case is a 59-year-old patient. She also had problems with the under eye area, which also improved at 3 months and at 6 months as well. We have another case with a baseline. You could see that her eye bag is a little bit bulging at underneath, and it also improved. So this is the volume measurement of all the patients. You could see that the blue color indicates that the eye bag is lessened or better. You could see that the blue one is actually very prominent at 1 month and then still continued to improve until 6 months. You could still see the blue color as the improvement. Another one of our patients also improved as well. So you could see that the eye applicator targeting the orbicularis oculi actually helped a lot with the sorry, orbital area. And also, you could see that the eye bag actually improved a lot as well in terms of volume. So next in the study, we have the lower face area. So we have a new applicator. So this applicator actually targets to stimulate the zygomaticus major and minor and also rhizorius, which is on the lateral part of your face. And this one is actually improved in terms of texture and also the volume as well, because we want to as well create more muscle tone to lift the face up, and with the synchronized RF, create neocollagenesis and tighten up the skin as well. However, the new applicator that targets the submental actually targets the digastric muscle. So with this applicator, we could target the submental fat and the submental area as well. So in this study, we also included 20 patients, but a little bit younger than the first group. So the mean age was about 47, and most of them were female with Fitzpatrick skin type 4. The pain score was actually a little bit more than the periorbital area because the applicator is a little bit larger, but it's still about 2 to 3, and it's very tolerable as well. So in terms of volume change, you could see that the submental area improved significantly at 1 and 3 months after completing 4 treatments, while the jowl area improved significantly 1 month until 6 months after completing 4 sessions of treatment. The lower face area also improved 1 month until 6 months after doing the treatment. So we also measured in terms of the melanin index to see if the skin change in color was significant. So we could see that 1 week after the second treatment, the melanin actually improved, but after that, it was comparable to baseline. In terms of the textures also improved significantly at 1 and 3 months after completing 4 sessions of treatment as well. Of course, we also want to see the ultrasonographic findings because we want to know how objectively it could actually decrease the fat or increase the muscle tone. So what we found that the zygomaticus major muscle actually increased in terms of thickness significantly from baseline until 6 months after completing 4 sessions. This was also found in the terms of submental jowl fat thickness as well. So it also decreased significantly at 6 months after completing 4 treatments. Patients also rated a very good improvement rate as well. Okay, so let's see the ultrasound images. So you could see that the white part on the above, that is the subcutaneous fat, and you can see the fibrous tissue underneath that divides the fat and the muscle before each other. So you could see in the before photo, the subcutaneous fat is a little bit thick and the muscle is a little bit thinner. And then after 6 months, you could see that the subcutaneous fat is lesser and the muscle tone is larger. So you could see the muscle thickness at the resting face. The next one is also the submental area. You could see that the subcutaneous fat also significantly decreased in this case as well. So let's see how clinical photos. So this one is one of our patients that in her study, you could see the submental area that have improved significantly. You could see her double chin in the baseline very clearly. Why 6 months after completing 4 treatments, the submental area improved significantly. Okay. And the side view, you could also see that her submental fat decreased significantly as well. Okay. This is a close-up of baseline 3 months and also 6 months after the treatment. You could see that the fat, the double chin of hers actually improved a lot. So this is a vector 3D photo to see how much improvement we have. And of course, what we want to see in this one is the improvement of the submental area. You could see that the blue and the green hue is the volume that had been decreased in the area after doing the procedure. So in conclusion, the high phase technology, which is high intensity electric field that emits simultaneously with synchronized RF, actually could improve muscle tone by 31%, whereas the synchronized RF or the monopolar that is emitted simultaneously, creating a uniform heat, could actually improve neocollagenesis and tighten the skin very good as well. So it lessens the wrinkle about 37%. So that will be all for my talk today. Thank you very much for having me.
Thank you very much, Dr. Yanin. So next, we are going to move to the third or the last speaker. And everybody look like they keep a very good time. So we probably will have 5 minutes at the end for Q&A. So next, I would like to introduce Dr. Lee Xianyan from Taipei, from Taiwan. He is a dermatologist who have expert on the aesthetic dermatology and advanced aesthetic dermatology treatment. Please join me to welcome Dr. Lee.
Okay, thanks for the kind introduction. And good evening, dear colleagues. I'm Dr. Jian Li from Taipei. You could also call me Jason. Okay, today I'm here to share my personal experience of using Axiom for the past years. And I think most, or maybe some part of you have learned or listened to my lecture before. And I think the most ideas were the same, but I'll emphasize on some mechanism discussion and some experience of using this for the past few years. Okay, I'm Jason. I come from Taipei. I'm a dermatologist based in Taipei. Okay, so I don't know how do you familiar with Axiom? Okay, this is a microneedling radio frequency, but the most unique part of this machine is monopolar. Okay, because if you are thinking about microneedling radio frequency, you are seeing most of these indications, like fine wrinkles, pores, skin rejuvenation. Those are very superficial indications. But those are, most of the machines in market were bipolar radio frequency. But Axiom is very unique. It's monopolar radio frequency by microneedling. So it's a very unique microneedling radio frequency in the market. You could see this in this lady, we use the traditional mode over her face. So you could see, yes, it could be good effect of using this for the traditional fine wrinkles, for skin rejuvenation, but Axiom has other effects. Okay, you could see this before and after pictures. And do you think you could do this by just microneedling radio frequency? But this could be done by Axiom. Okay, this is a case of Axiom. Okay, so every time when we're going to treat our patients, we always think about the depth of treatment. So do you think when we compare Axiom to other HIFU or radio frequency system, it's better, or it could be evenly or non-inferior to other comparable systems? Okay, so let's take the secret about Axiom. Okay, before any treatment, we always think about the treating depth. Okay, so when we're using non-invasive monopolar radio frequency, like Samaj, okay, so we start to hit the skin from the very superficial area, and the heat will transduce to the deeper area. But the maximum may be 4 millimeter or 4.2 millimeter. That would be the maximum. And for HIFU system, you could separate, you could hit the specific depth, but maybe 3.3 millimeter, 4.5 millimeter, or in some machines, you could hit the 6 millimeter depth. But yes, but our face, it varies. It's that very important literature, because you could see in the middle part, the subcutaneous fat area, the superficial area, the depth or the thickness of this part could more than 6 millimeter. That means when you're going to hit the skin tissue, some areas it will thicker than maybe 6 millimeter or 7, even 8 millimeter, especially in the jawline area, especially in Asian patients. So we're targeting different depths. So different depths need different treatment strategies. And you know, yes, different areas, the thickness differs. Okay, in the forehead area, it's quite the same between male or the female. It's about 1 to 3 millimeters. Okay, but in the submental area, like this thin face, you could see it's about maybe 3 to 5 millimeter depth. But in some ladies, especially in the forehead area, the depth will be quite the same, okay? But in the submental area of some cases, you could see the depth is totally different and it's much thicker. So when we're going to treat this area, what could we do, especially when we're using microneedling radio frequency? Okay, so that's the secret of Axion. Okay, so today my topic is unlocking the potential or extended mode. When Axion is first designed, the extended mode, they only suggested to use in the body indications. But I turned on it over the face area. And what could we do with this kind of turn on the extended mode? Okay, so the uniqueness of Axion, monopolar is the most important because the energy would go deeper from the tip of the needle. And when you turn on extended mode, it's very special. I'll explain it later. And it could be used in all skin type because it has insulated and non-insulated tips. And it's AI assisted. So it makes it a very special monopolar radio frequency system, and it could treat a lot of possible indications around the facial areas. Okay, and the most important is monopolar. And today we'll dive deeper into the megahertz. The frequency is 1 megahertz frequency. It's another special point of this mechanism system, okay? Okay, extended mode. Okay, we are talking about extended mode, What is extended mode? In Axion, when we set the energy, if we turn on the extended mode, that means the energy, if we do not turn on extended mode, the energy is limited around the tip of the needle. But when we turn on extended mode, the energy will go deeper, 4 more millimeters from the tip of the needle. So it will trip deeper. And it also have a very good advantage of decreasing the painful sensation. Because you could see the chart here, when the physical needle penetrates deeper, the painful sensation, the pain score, elevated a lot by the physical penetration. So it could image like this. In traditional bipolar radio frequency, if we want to treat the depth of 4 millimeter, you have to go deep into the 4 millimeter area, and it would be very pain. But Axion could also do this by turning off the extended mode off. But you could try to think about this. We use physical penetrating 1 millimeter, but we turn on the extended mode. That means we're heating from 1 millimeter depth to 5 millimeter depth. That would be heating from 1 to 5, but the painful sensation is only physical penetration of 1 millimeter. So it decreases a lot of pain. So you could see the subtitle of the display there. Okay, less pain, yes. That is what Axion could do. And in traditional contact radio frequency like the March, you could see we're heating the tissue from the very superficial area of the skin. So we said that it could have smooth lifting or fat reduction effect. So how about Axion? If we go 2 millimeter penetration depth, then we turn on the extended mode. So the energy will go through 4, 5, or even 6 millimeter depth. So will it have lifting effect of the smooth or tightening effect? You could think about it. So I think it's even deeper with higher energy. It could possibly, or it definitely will have better effect compared to the March system. Okay, so maybe the treatment idea here we could think is like this. We could use extended mode off in the very superficial layer of the skin and in a relative low energy to improve the skin quality like traditional microneedling radio frequency. But we could also use Axion with maybe 2 millimeter penetration depth and turn on the extended mode. So we could hit two different layers. And in the deeper area, because it's far away from the very superficial area, we could reduce the possibility of PIH, so we could turn on higher energy, and it's relatively safer to turn on higher energy in the deeper penetration depth. Okay, so we could see this before and after pictures. This young lady, in traditional our design, we won't use microneedling radiofrequency for this kind of cases because she's relative okay in skin quality, and she's relative okay. So we'll use maybe HIFU system in her face, but I use Axiom over her face, and you could see the before and after pictures. You could see the choppy face improvement. You could see the lifting effect, or you could see the lifting effect. And do you think you could use HIFU system to achieve this kind of outcome? Okay, but Axiom could. Okay, so now in my daily practice, I would see Axiom as another kind of lifting machine, not only the microneedling radiofrequency. Okay, and think about another treating strategy, superficial layer, okay, intermediate layers. And maybe if you go deeper with maybe 2 to 4 millimeter penetration depth and turn on extending mode, then you could see, you could treat the soft tissue maybe 3 layers. Okay, so that's about the energy distribution, and that's about how to decide your patient of the total treatment plan. So this is the case at the first beginning, and you could see I use a lot of 3 layers therapy techniques over his face, and you could see the jawline area, the defined area of the jawline. You could see a lot of improvement. And you could also see a significant reducing or the decrease of the fat compartment. Okay, so do you think you could use more Submerge to achieve this kind of outcome? I don't think so, but Axiom could do. Okay, so we see a lot of cases with good fat reduction effect. So is there any explanation for the fat reduction areas? Okay, and what's the importance of choosing the 1 megahertz frequency? This is the literature. The author tries to compare the traditional 6.78 megahertz versus 2 megahertz. Okay, it concludes that the energy transfers along the fibrocepta perpendicularly, and it's the simulation of this paper, and you could see the energy between the Submerge system or the 2 megahertz system. The 2 megahertz system, the adipose side or the epithelial tissue heated a lot or more after using 2 megahertz. So the frequency differs and the effect differs. But the authors still think there's no evidence of apoptosis over 2 megahertz. But in this literature, the authors propose 1 megahertz radio frequency, and it seems to penetrate deeper with some buck heating, but they saw some adipose site apoptosis effect. Even they didn't mention it very clearly, but the author tried to explain with apoptosis. Okay, so 1 megahertz would be better effect with adipose site apoptosis. So that's why Axiom has good effect over the submental, the jawline, the fat adipose site, because you could see in the world of radio frequency systems, high frequency, the energy stays in the superficial layer, but if you use long wavelengths, the energy will penetrate deeper into the subcutaneous fat and even cause some adipose site apoptosis. That's what Axiom could do in the submental fat areas. Okay, so This is another case. You could see even she is thin, no, but after picture, you could see the tightening or the adherence would be better and some clearing of the definition. Okay, so in my daily practice now, I will set the energy like this. I'll keep relative low energy for the superficial penetration depth and high energy settings for the deep penetration depth of the system and turn on extending mode. And normal 2.5 millimeters and extending mode on always for the deeper areas. Okay, so this case we could see superficial, so I intended to treat only superficial, so I turned off extending mode on. Even I use double layers technique. And this lady, we saw the pictures, so I use double layer technology, but turn on extending mode with relative high energy in the deeper settings. And for this case, 3 layers of energy settings and 2 layers with extending mode on. Okay. And the long-term effect, you could see the following data. And this woman, she only received 2 times of Axion. Then after 1 year of follow-up, you could still see the effect is quite good. Okay, so in my daily practice now, I also combined the treatment Axion with other treatment, like Axion, exosomes for the aftercare, and PLA injection first, then do the Axion. Then sometimes I treat, because I see Axion as another machine for lifting effect, so I will use it alternatively use with HIFU or radio frequency system to make my customer, they feel we're always thinking about and we're always evaluating their conditions and make some customized design and energy devices for them. Okay, so this is my take-home message here. First, Axion is a microneedling radio frequency. It could treat the traditional indications, but with extending on, you could see deeper, less pain, and a lot of other indications with 1 megahertz frequency with fat apoptosis. And they would be the brief conclusion of today's presentation. Thank you for everything.
Hello. Okay, thank you, Dr. Lee. I would like to invite all the speakers on the stage. We have about 7 minutes left, so if anyone has questions, please feel free to raise your hand up, introduce yourself at the microphone. So I will be the first person who starts with the question. This question goes to Dr. Amon Pong. I believe most of our participants here in this room are dermatologists or aesthetic physicians. We are not quite familiar with the system on the brain that you were talking about. It's a magnetic stimulation system, right? So when I first heard about this system, the only thing that I worried about is the long-term side effect. Will we get long-term dementia or anything else 10 years later? Is there any long-term side effect that prove that this thing is very safe?
Okay, let's start with the Artemis. Artemis is not new. The technology is already in the market over 30 years. In the market, actually published long time ago. And when we look at the safety profile, it's very safe. We use the Artemis even used to stimulate the mind cognitive impairments. So only thing that when we stimulate with magnetic wave is create the neuroplasticity of this neuron, the brain cells. That's why when you look at this, the brain cell, the neuroplasticity, the effect, it lasts for certain periods. So that's why patient need to come back, and we need to stimulate the brain cell again. So with the safety profile published over 30 years, it's really safe. Only one complication that we concern is seizures. And the seizures is extremely rare. When you look at it in the study, extremely rare, I show the number, is 1 in like 10,000, or not 10,000, 100,000. It's extremely rare. Okay.
Thank you. So please go to the microphone. Please introduce yourself.
Yeah, thank you for all your nice lecture. I'm Dr. No from Seoul, Korea. I have a question about the Axion and about Dr. Lee. I just recently purchased the Axion, so I'm new to this device. And I think it's a combination of a HIFU or monopolar RF. But my question is the risk of this machine. So what is the maximal level that you tried with this machine, which depth? And then how about using the extended mode with a very superficial layer, something like 1.0? Is it okay with the epidermis layer? Yeah, I have 2 questions. Thank you.
Okay, so one is the energy settings and one is for the depth. Okay. First, normally, if I use some patient with chubby face, I will turn on the extended mode on and use the 100 or 90 degree of the energy settings.
90%.
90%
Yes,
of
yes.
100%.
100%.
Yes, because I didn't see some complications with that, because always about the penetrating depth, because when we go with 2.0 millimeter or 1.5 millimeter, we have penetrate deeper than the dermal and epidermal areas. And those areas are prone to have higher possibility of PIH or superficial burn. But if we go deeper than 1.5 millimeter, so that's the second question. Yeah. I will go superficial layer with extended mode on if the penetration depth is less than 1.0 millimeter. Okay, that's the most superficial depth I will use. But if I go more than 1.5 millimeter, I feel relatively safe, so I will turn on the energy settings as high as possible as the patient could tolerate.
Okay, thank you very much.
Any more questions from the audience? So Dr. Yanin, when I look at the result, actually this is the first time I saw the result. Yes, we saw quite a visible and significant improvement, but the improvement is not very, very strong. So in clinical practice, do you think that we should add up more number of treatment or add the other adjunctive treatment to improve the outcome?
So I think depending on how fast your patients want to get, you could actually customize. So if your patients wants a journey, like a slower journey to gradually improve the outcomes, you could add more accession, of course. But sometimes if your patients are very eager to have a very fast improvement, you could also add combination of other treatments as well. Thank you.
Dr. Lee, I saw in your presentation that you also apply injection of the biostimulator after the treatment with your Axion. Actually, we published a study this is a split phase study by one side treating atrophic acne scar. We do Axion on both sides, and one side we drop injection formula of PLLA without injection, just drop in and gently massage for 2 minutes. And the other side we use normal saline. And at the end of two treatment, we saw a significant difference in terms of the improvement of the atrophic appearance without injection. So we believe that this is a dual effect, effect of RF itself and the stimulation of PLLA. But the benefit is we don't physically inject by using needle. That means we avoid the intravascular or some complication of injection. Have you ever used that idea in your practice?
No, I'm not using PLA immediately after microneedle radiofrequency, but it depends, because in this topic you have to think about what kind of product you're using, because different PLA, their characteristics also differs. Okay, so if you are talking about Sculptra, but I'm more afraid of using Sculptra over the very superficial area, especially after microneedling, because it's the advantage, but it's also the weak point of Sculptra because it produces too much collagen. But if you use microneedling or some mesotherapy by using Sculptra, that means if the complication happens, that would be hard to deal with the complications. But you know, in other brand of PLA, like some round-shaped PLA, it's relatively safer to put it into the very superficial areas because they don't produce that much information and they don't produce that much collagen. Okay, so that depends on the products. And I also saw your literature and I admire that.
Thank you. I think we have time for the last question. Dr. Paisan, would you like to finish with your last question?
Yes, since the interface is quite a good technology, but just I didn't attend at the beginning, but for the technology of this electrical stimulation might add up our facial lifting. Other than the first, second layers, then we can pump up to the deeper part of the face in order to firm up or lift up the face. That is still very popular. Thank you. Thank you.
Thank you very much. So we come to an end. So I would like to thank all of the participants who joined the symposium from the beginning to now. And I would like to thank all of the speakers. Please give a big applause to all of the speakers. Thank you very much.